40-year-old Sidharth Shukla's death has brought back discussion on how severe the problem of a sudden cardiac arrest is, how young people, the younger population in India, is losing their life to a sudden cardiac arrest. To talk more about this, I am joined by Professor Dr. Ambuj Roy from the Department of Cardiology of AIIMS New Delhi. Sir, thank you so much for joining me on India Today. Firstly, this sudden death of a 40-year-old actor, Sidharth Shukla. What could be the reasons behind a sudden cardiac arrest and death from it?
Yeah, this is a most unfortunate incident, and my condolences to the family and everybody. While a celebrity like this does bring it into media focus, it's not unusual for us cardiologists and physicians who see heart patients to see young MIs, what we call MIs in people with less than 40 or 45 years of age. And if you look at data from India, almost 1 in 4 heart attacks occur in people who are younger than 40 or 45 years old. So this is not unusual. Most often it is because of sudden blockage in one of your coronary arteries which supply the blood to the heart, leading to sudden disruption of blood supply and subsequent sudden death. So it's not really so unusual for us, but it is a huge problem, MIs in young, especially in India.
So why is this problem increasingly becoming so common, as you just mentioned? Because if we talk about celebrities and especially actors, most of their life, you see them follow an exercise regime, follow healthy eating. What could be the possible explanation of someone as young as 40 years to die suddenly of a cardiac arrest then?
So I would say several reasons. If you're talking about celebrities, they have a very stressful life, right? There are all kinds of pressures to perform. There are, targets to be met. They work very odd hours, and all this definitely brings in a lot of stress. Lack of sleep, for example, is a very common precipitant for heart attack. Stress, if you see most of the large cities, is responsible for almost 25% of heart attacks are because of psychosocial stresses, shown in large study. So one of those are a couple of reasons, but I'm not talking about individuals, but in young, tobacco use is one of the most common precipitant of heart attack. And it's been shown that among people less than 40 years of age, 60% of the heart attacks are due to tobacco abuse, whether it be in form of cigarettes or whether it be in form of chewable tobacco. And it really puts you at a very high risk for heart attack. Then again, drug abuse. It is again picking up a lot among young people. Various drugs are abused, whether it be cocaine, whether it be amphetamine, or marijuana, weed as we know it. They're all known precipitants for heart attack, and they lead to clots in your coronary arteries, the arteries to the heart, and give you sudden death, and sudden heart attacks are well known because of such things. So, these are the factors which are possibly play in young heart attacks.
Doctor, what explains the correlation of mental stress as well as lesser or lower cardiovascular health? Does mental stress form that much of a bigger contributing factor apart from usage of tobacco or drug abuse or even not sleeping on time? How much does mental health form a contributing factor to cardiac arrest instances?
Yeah, so mental health through various disturbances which leads to increased hormones, which are stress hormones in the body, like catecholamines, which clearly increase your heart rates, increase your blood pressure, and persistent presence of the stress. I'm not saying one-off stress here and there, which is very important part of your life, but persistent stress, living under stress, working odd hours, lack of the rhythm of sleep. All of this leads to hormonal imbalances in the body, which are not good for the health of the heart or health of the other parts of the body too. And they act as precipitant of heart attack. They increase the, I said, your pulse, heart rate. The heart is much more under strain. And so in a susceptible person, you're much more likely to have an heart attack if you're living under constant mental stress.
Doctor, would you also say that when we talk about the fast-paced life of today, where youngsters are more ambitious, they are more driven to work longer number of hours, do you think that could also be categorized in a lifestyle that most people have today that could lead to such sudden deaths due to cardiac arrest?
Yeah, definitely. There is increasing pressures to perform. There are more and more deadlines to be met. You don't have the usual working hours. You work long hours. You work odd hours. And there's a lot of pressure, which clearly, as I said, leads to hormonal imbalances and clearly stresses your heart, and it is a precipitant. And along with this stress, then comes changes in other lifestyle factors. For example, you don't have regular home food. You would having food from your workplace, or you'd be ordering food out, and many of the time these are not the best kind of foods for your heart. For example, you eat pizzas, you eat burgers, which are what are categorized as junk or fast food, and they're not nutritious and wholesome. And clearly, it has been shown that a good amount of fresh fruits and vegetables are protective to the heart. So, obviously that does not form part of such a diet. And then with stress comes in things like use of tobacco or use of other so-called perceived stress relievers, which are not actually stress relievers, which actually stress your body further. You must have heard of taking a break and having a cigarette, for example. A lot of people do that when they're stressed, but they don't realize that further stresses your system.
Right.
So it has, I would say, a downstream effect. There are multiple other mental stress leads to other stressors on the body, which could be precipitants of heart attack.
Doctor, what can one do to be aware of this problem? And now that we're looking at the fact that India has one of the largest number of people who are suffering with diabetes, even the incidences of cardiac arrests have increased in a country like India. What should people be aware of, and what should people do to take care of their health?
So, as South Asians, as a population, are at a higher risk for heart diseases, and this has been shown by several studies in the diaspora living abroad, whether it be from the United Kingdom, United States of America, or even Singapore. The South Asian, as an ethnicity, is considered a risk factor for heart disease. Unfortunately, we can't do much about it. Those are the genes, we have to live with it. But there are other things which are modifiable. So living a healthy lifestyle, which means at least 30 minutes of physical activity most days of the week, complete avoidance of tobacco, diet which should be rich in fruits and vegetables, avoid junk food, avoid food which is laden with saturated fat, too much of salt, too much of sugar. Both are as harmful for a healthy life in general. And then, beyond a certain age, everybody should get an annual check in terms of his blood pressure, blood sugar, and cholesterol. 3 important risk factors for heart disease. So, doing these 6-7 things on a regular basis will definitely bring better health to your heart.
What would you finally like to say to people who are more ambitious, more driven, who work long hours, don't take vacations? Of course, during the pandemic, we have seen how there's been a social disconnect between people, and largely people have stayed away from families, from friends, from entertainment. What would you like to say to such people?
Yeah, I would say just as much you're working for your professional life, you need to work on your personal health. I'm not saying, we are all under stress. That's how modern life is. And I'm not saying we to give it up. That's not realistic. We have to work. But, in a day, as I said, you must take out that 1 hour for your body. I'm sure if you plan your day well, you can do that. Do that, do a good amount of physical activity, indulge in good, healthy diet as far as possible, say complete no to tobacco, and once a year checkups on very basic tests of your blood pressure, blood sugar, and cholesterol will go a long way in preventing heart disease.
Well, thank you so much, Doctor. These are very important points because we rarely do focus on our own health, physical or mental. And when suddenly the news of a demise of an actor or someone we knew or a celebrity comes forward, we do wonder what went wrong. But clearly, there is a link, a direct correlation between mental stress as well as low cardiovascular health, which could lead to problems of cardiac arrest and leading to sudden death from that. Doctor, thank you so much for joining us on India Today.